Perfect. That's her upper back adjustment. Go on your side facing me. Perfect. Other side. Good. Move it out for me. Perfect. And this one real light. Hi guys, Dr. Randy. Got Shauna in the office again, our massage therapist. I'm just going to adjust her today. I wanted to shoot a video. Her neck is bothering on her right side. Is anything else bothering you?
Lower back, all right side.
Low back on the right side too. We're going to do a full spine adjustment video. I'm going to start her off with some traction. Slide down towards me a little bit. Okay, Shauna. So she's on her feet a lot, working on patients. We use this for a lot of nurses as well, hairstylists. You know, a lot of patients are either sitting for prolonged periods throughout the day or they're standing still. So this extra decompression of the lower back vertebrae is really key, really helps take stress off the disc and the spinal nerves of your low back. I'm sort of, with my upper hand, sort of blocking, and then the traction occurs below my hand, right where I want it to. In this case, like sort of L2, 3, 4, 5, and below. And then we can sort of move it side to side to get a little bit of the SI joints. So as I go left, we're kind of stretching her right SI a little bit more. If I go right, we're stretching the left SI a little bit more. All right. Great for low back and hip pain. Okay. Take a deep breath in, Shauna. Exhale, relax your arms all the way out. Perfect. That's her upper back adjustment. Go on your side facing me. Take a nice deep breath in. Exhale. Perfect. Other side. This arm on top for me. Take a deep breath. Exhale. Good. A little tight there. You okay? Mm-hmm. So she's got some restricted motion segments right through here with like accompanying soft tissue swelling and tightness. And this is something that, I mean, she's a massage therapist. She's a little more in tune with things because she works on patients all day. But anybody watching at home they may have some general neck pain or headaches, but you may not realize how out some of these joints are until someone presses on them. As I press on them, you can really feel more tenderness, and that is because of a buildup of scar tissue and almost a little bit of like inflammatory chemical buildup around that joint. So we want to reset that joint, reset the muscles in that area, and that's what the adjustment does. So when someone palpates it, you can feel just how out and tender that spot is. Okay, just relax your shoulders. Let your head drop for me. Perfect. And this one real light. Perfect. Now that was a good one there. And then you like the traction, right? Mm-hmm. Now, pick your knees up. Deep breath. So we can get a lot of patients to actually pop even a little bit more with this traction. It sort of decompresses, just like we decompress the lumbar spine, we're going to decompress her cervical spine with what's called Y-axis traction. And you can just imagine why this is beneficial, because we're all on our phones and screens all day, or bent. In her case, she's bent over, sort of looking down at patients working on their backs. And so this kind of just decompresses and stretches those vertebrae along the longitudinal axis. Good. Takes pressure off the spinal nerves, allows blood flow to get to the disc. And we'll do one more. We sort of hold each one for about 20 or 30 seconds. And that's that. Come on up and do your shoulders and you're done. So quick full spine adjustment, but it goes a long way in keeping her spine healthy and functional, having less back pain, of course. Just coming around with this hand, just relax this arm. Same thing, coming around with this hand, this is her shoulder adjustment. That's it, thanks.